Hi, I'm Dr. Davin Turner, the Chief Administrative Officer at Mosaic. It's been a while since we've come to you in video to give you an update of what we're seeing in the system and in our region around what's occurring in health and basically around the flu, RSV, COVID at this particular time. We are seeing a spike in the region quite dramatically and across the state in our cases of influenza, the flu, RSV, mostly seen in children but can affect adults, especially those with chronic lung disease. And we continue to see COVID rise and fall across the nation. Over the next weeks, we'll be talking to you about what are some of the opportunities to stay safe, take care of yourself, and protect yourself in this season that we're seeing. We are seeing a very busy influenza season, and most should not be surprised. For the last couple of years, being in masks, social distancing, we did not have very severe flu seasons. This season, however, will be much different. We're seeing a large number of flu cases that are impacting us across the region and at all the hospital facilities. We are also seeing a big spike in respiratory syncytial virus, RSV, which is more for kids, where the pediatric hospitals are full with these patients. So we just want you to know today we'll talk about the flu. What are your signs and symptoms? Some of these can be similar, but for influenza, the usual signs and symptoms are body aches, fevers, chills, headache, possibly a dry, persistent cough. Sometimes you can have some mild shortness of breath, tiredness, weakness, runny nose, a little bit of sore throat, and some eye pain, and other symptoms. Everybody's a little different. There is treatment for influenza, and there is prevention. To take the vaccine. The vaccine is not 100% effective. However, it usually does limit the course and also lighten the severity of illness. So it is something that people really want to get, and I certainly encourage those, especially with other medical conditions, to get the influenza vaccine. We are seeing younger adults more severely ill this year with influenza. Really, that's a product of the last 2 years of very limited disease. There are medications if you seek care quickly. If you're seen by your primary care provider and diagnosed with influenza, there are medications that can be prescribed. You do want to seek care within the first 24, 48 hours, or at least possibly have a virtual visit as we talk about the right places where you're going to be most successful and most likely to be seen. Virtual visits work a lot of times well to at least triage where you'll need to go. You can call the nurse line to help direct you where to go, or your primary care is also another great place to go to get diagnosed and then possibly get the effective treatment. Certainly you may hear that there are shortages of some of those medications. The pharmacies get these in over time, but you definitely want to get your diagnosis so that we can get the prescription in your hand and hopefully help you. There are also signs and symptoms when you may have flu or other illnesses where you're more severely ill and you need to effectively seek care, possibly at urgent care or in an emergency room. And they're very similar whether kids or adults. Severe difficulty breathing. I just can't get my wind. And you can tell in children, they may appear pale, gasping. You'll see their ribs really raising. In adults, we recognize these symptoms. You could have severe chest pain. This could be because you have secondary pneumonia or other causes, and certainly would lend you to want to go seek more aggressive care either through an urgent care or the ER. Possibly seizures from high fever. Overall worsening of your medical condition, not able to keep food or drink down, excessive vomiting, and those symptoms would make you want to seek that immediate care at a higher level of care. And that goes for both children and adults. Again, I want to talk about the vaccine. You really need to think about getting your influenza vaccine, especially those with other medical conditions. The vaccine is safe. Talk to your primary care provider. or even have a virtual visit about making sure this is right for you. The vaccine can be usually attained either at your PCP or local pharmacies, and certainly we encourage that. Wash your hands frequently, use hand sanitizer, and don't touch your face. One of the biggest things, if you go to the store and you touch an object that possibly has been contaminated, you then touch your face and you can transmit the disease to yourself that way. Utilize your primary care office for one, your basic health needs, but if you're like, I'm getting a little sick, reach out to them. If you think I'm more ill than that, call urgent care and to see if what your symptoms may say, hey, I need to go there, or I'm going to go seek care there. The virtual visit's, again, a great option to get answers and maybe even direct you, or call the nurse line. The emergency room, that's where you go when you're severely ill. We are seeing large numbers of folks coming to the emergency room. Our hospital census is running over 250 here in St. Joe. Albany and Maryville are also seeing higher volumes just because of the influenza that we're seeing in the region. So that emergency room can be very busy, and you may have extended waits if your illness, yes, you're sick, but you're only mildly ill. That's why we recommend that you seek care at your PCP, again, virtual visits, possibly urgent care. Use that emergency room for those very severe illnesses or injuries, the things that really make sense to go there just because of the large volumes, and we don't want you to have to wait in the waiting room for extended periods of time seeking care. Wash your hands. Don't touch your face after you've been out. And certainly if you feel ill, stay home. Don't go out in the area. We will be giving you updates on other of these respiratory illnesses we're seeing, not only, again, updates on influenza, but RSV, respiratory syncytial virus, or COVID or parainfluenza, just keeping you updated and also letting you know, about where we should go to seek care, and also giving you updates on our status, on where we're at right now. You will expect this to be a long season. We're starting early this year. Hospitals are going to see large volumes well past the holiday season and into the spring. So again, stay safe, take care of yourself, and let us know how we can be of assistance.